Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, I speak with Jennifer Cates, Senior Vice President and Director of Global Health and HIV Policy at the Kaiser Family Foundation. We discuss a recent article co-authored by Cates titled, "What Happens When COVID-19 Emergency Declarations End? Implications for Coverage, Costs, and Access." Let's listen. Jennifer Cates, thank you so much for joining us. The federal COVID-19 public health emergency was first declared in January 2020. It's been renewed every 90 days since and is now renewed until January 11th, 2023. First, tell us about this declaration and maybe some of the key flexibilities or allowances that will be implicated when this ends.
Yeah, hi, it's good to be here. So as you noted, this public health emergency, this is a specific declaration that can be made. The Secretary of Health and Human Services can make this declaration if it is required based on circumstances. And it's called 319 for those who want to know the exact number of this declaration. This was done first in January 2020 under the Trump administration when COVID cases were on the rise and there was growing concern. And it's been in place since. It's an important step because essentially there's sort of a symbolic part of it, right? Everyone hears, oh, wow, there's a state, we're in a public health emergency. This is really serious, but it has mainly practical implications. It allows the federal government to have flexibilities that it wouldn't normally have. And it also allows the federal government to put in protections for people when it's a time of emergency. So in this case, as an example, the public health emergency declaration has allowed the federal government to protect people against certain kinds of costs they might otherwise face when they're trying to get access to COVID treatments or COVID tests and other things. And it's also allowed, expansion of Medicaid to cover people who might not otherwise be eligible for Medicaid for COVID services. So it provides a number of flexibilities and special provisions that are really designed to protect people, allow things to move fast, and be responsive to an emergency.
One of the things that's included in this is the fact that the FDA can declare emergency use authorization for things like vaccines, tests, and treatments. We still have a number of these things that are under EUA. So how is that implicated?
Yeah, so it's interesting. There's more than one emergency declaration that can be declared. And the one that everybody is most familiar with is this PHE 319. I'll just call it that. And that's the main one. And that's the one that provides a lot of the flexibilities we're talking about. There's another one. It's the 564 declaration. And it's the one that you just referred to. It's a separate declaration. It's not dependent on this first one. It also has to be made by the Secretary of Health and Human Services, determining that there is an emergency for the purposes of several things, including allowing the FDA to give emergency use authorization to medical countermeasures, that's like vaccines, tests, treatments, as you said, that otherwise would have to go through a full process of approval, which frankly takes quite a long time. And the idea here is if you're in an emergency, you're developing new things, or you need to get things out to the public quickly, can you have a quicker process that still ensures safety and ensures effectiveness, but isn't that full, approval? So that is still in place. That is that actually will end at some point, but we don't expect that to end at the same time as this first one. So that is an issue when it ends that we could talk about, but that's not the one that is imminent, or not imminent, but the one that everyone is focused on right now.
Yeah, I do think people tend to lump all of these things together. So it's important to break that down. So tell us a little bit more about the flexibilities involved with like Medicaid and Medicare and what that means for families and individuals.
Correct. So, one of the things that this PHE declaration has allowed is normally, if you were going to get a COVID treatment or something, or treatment, just say you're going to get treatment or you're going to get a vaccine, normally you might have to pay for these things. It depends. There's some protections already built into the law because we have the Affordable Care Act. But in general, people might face cost sharing. They might, not be able to access these things unless they're in network. All of those normal like healthcare marketplace provisions that we all face for those who have insurance, that people with insurance face anyway. The PHE allowed protections to be put in place so that people wouldn't face cost sharing and wouldn't, for the most part, like in Medicare and Medicaid, and wouldn't have to be in network and things like that for many of these things, not all, but for many. It also put in place, if you think about it, in the US, we don't have universal health coverage. There are people who are uninsured, and if they're uninsured, they don't get access to healthcare easily. They have to pay out of pocket, or they have to go to a safety net provider, and that's a real hardship, and that has implications for health outcomes. Because of the public health emergency, and also, frankly, the federal government paying lots of money to buy vaccines, tests, and treatments, those are made available free to the uninsured during this period. Those are the kinds of things protecting people from costs and undue hardship. Separately, the federal government provided free products by purchasing them for people because of the emergency. So those two things kind of work together, but those are kind of some of the flexibilities.
And speaking of those products, what happens when the federal supply of these things like vaccines, treatments, and tests runs out?
Yeah. So this is a big issue that I think everyone needs to understand. The federal government, the Biden administration, has reported and said several times that they are out of money to buy more of these products. So far, you and I and everybody in the U.S. has gotten everything for free because it was purchased by the federal government. And there's been these cost protections where there might have been costs. The federal government doesn't have money to purchase them anymore. When those supplies run out, people are going to face, in some cases, a different situation. There's some good and bad here. On the one hand, on the vaccine front, the good news is that almost everyone who has insurance will still get free vaccines. We are protected in our insurance system, in part because of the ACA and in part because of some other protections the federal government has put in place permanently. So if you are on Medicare, if you're on Medicaid, if you have private insurance, for the most part, you will still get free vaccines. We'll come back to the uninsured in a minute. Treatments is a different story. When the supply runs out, generally what's going to happen is going to be what you usually face when you go to get a treatment that you might need for any health condition. You might have cost sharing. You might have to go to in-network. So some of the protections that people might have been used to won't be there for treatments anymore. Same with tests. Right now, I think first of all, you can go to your doctor we can get PCR tests and those can be reimbursed. That will likely still be the case for most people with insurance. But say goodbye to the free at-home tests, where we're all getting used to going to a COVID center and picking them up, or sending in, everyone's entitled right now to 8 free tests per month so you can get reimbursed. That's going to go away. So that's a difference. Now, the uninsured is a different story. Once the supplies run out, there is no mechanism to provide them with vaccines, treatments, or tests. That is a serious issue, especially if we're talking about, potential time of surge in cases. You want to protect everybody and the community. The other issue that I think people need to just pay attention to, even, we could say, okay, well, most of us are going to get free vaccines. That's great. Well, right now, the federal purchase of these vaccines, the federal government purchasing millions of doses, has guaranteed a market to these manufacturers. The federal government has said, we're taking the risk away from you. We're buying these doses up so that we can be assured that we will have them for the population. That guarantee is going to go away. So now it's going to follow the market. And the manufacturers will have to decide based on however they make an assessment, how many doses to produce. Does that mean there's going to be enough doses when we all need them? We just don't know yet. So that's another wrinkle in this situation. Yes, we can theoretically get them for free if you have insurance, but you want to make sure they're going to be there.
So I want to ask you about the ending of this emergency, but I want to stay on this topic of supplies first, because the supply is a finite physical thing.
Correct.
That is going to run out. What if that happens before the ending of the public health emergency? What's the implication there?
Right. So if the supply is already going to run out, probably I would guess that we're okay on vaccines for quite a bit. But if the supply runs out on the others, that's what's commercialization. That's when it's really the marketplace. That's already happening with some treatments, and it's been happening with tests. You might remember, here's an example. Okay, so about a year or so ago, not too long after vaccines started. So vaccines started to be rolled out in earnest to the American public in early 2021 through the spring. And then rates, COVID cases started going down, deaths started to go down, hospitalizations. It was felt like a whole new ball game. Well, what happened? We got hit with a variant and cases went up and hospitalizations went up. Everyone wanted to get tested. There weren't enough tests. There was a testing shortage. Well, why was that? At that time, the federal government had not bulk purchasing many tests, some, but not many. And there just wasn't, we actually did a study of this. The manufacturers, we could look at their reports and they said, we don't see demand. So they didn't see that there was a demand. There was no guaranteed market at the time. They didn't have enough supply. And so there was a catch-up period. And what had to happen at that point, the administration actually bought a lot of tests and guaranteed more of a market, and then put in this rule that we have still, that people with insurance are essentially guaranteed to have 8 free tests per month. That goes away when the public health emergency ends. So all that is to say is if the supplies run out before the public health emergency ends, we could see some supply challenges. Even if you're guaranteed free stuff, there could be, I'm not saying there will be, but that is a concern. And I know that the federal government is working with manufacturers to try to proactively address that.
Health and Human Services is required to give 60 days notice before lifting this emergency. That's basically this week. Do you see the possibility of another extension here?
I mean, we just don't know. Anything is possible right now. They are due to announce, like you said, shortly. What it means is if we don't get anything, if nothing gets stated, that just says, okay, we're going to extend it. So after January 11th, it's going to be extended another 90 days. If they come out and say, this is your 60-day notice, I mean, I think it will be hard. It will be hard to unravel in that amount of time, and it will have some pretty significant implications. So, I don't know what their calculation is going to be. I think it's possible they could extend it some further because of all that has to happen and be put in place to make sure that people are as protected as possible. But, well, I don't know. I don't have any good predictions on this one.
But at some point, the state of emergency has to end. So what would you look for to signal as an appropriate time to do this? And what can be done to sort of lessen the blow of rolling back all of these allowances and flexibilities?
So I think, some things, first of all, I think an appropriate time, some of this is people have different interpretations, right? So right now we have 300 to 400 deaths per day due to COVID. To me, that doesn't say we're out of the woods, we're out of the emergency. So at some point, I guess seeing lower numbers of deaths would be helpful to provide more confidence that we'll learn to live with this in an easier fashion that has less hardship and bad outcomes for people. And also, I personally think getting through the winter and seeing if we have what the increase in cases looks like. It's just hard to check. So those are a couple of things that might be helpful. But also, the federal government has started a process to work with manufacturers, and that is a process. And I think that process needs to play out a little bit so that what we do experience when the emergency declaration is over is more of a smooth ride as opposed to a cliff. So, there are things that can be done, and hopefully they're being done. Also, the way that the laws have been, so in addition to the public health emergency, Congress also passed several pieces of emergency legislation to bolster those protections. And some of them actually say that once the public health emergency is over, there are some protections that will still be in place for another year. So they recognize that there has to be some cushion here because it can't be so abrupt. So that's a good example of something that could be helpful. But I do think it's preparation with manufacturers, getting through what could be, a difficult winter, which we don't know yet, and hopefully lower numbers of deaths a day would be some of the things I would look for.
Can you give us an example of some of those provisions that would last beyond the public health emergency?
So as an example, and this is a good example of how the PHE and some other protections that Congress put in place work together. So the American Rescue Plan, which was very important piece of legislation that was passed to address COVID, requires that Medicaid and CHIP programs cover all drug products for COVID, for the treatment of COVID or prevention of COVID, with no cost sharing for enrollees through the end of the last day of the first quarter that begins 1 year after the PHE ends. In other words, when this PHE ends, I mentioned that people will face cost sharing for treatments. This actually puts that off for a year. So it puts in additional protection for, frankly, low-income people that rely on Medicaid, and cost sharing could be a hardship. After that, there could be some cost sharing that could come into play. So that's an example of something that has been done that will allow for an extension. There's one other thing I wanted to highlight, though, because I mentioned it earlier, is this issue of the uninsured. So, it's obviously predated COVID that there is this challenge that we don't have coverage for, they're not insured. We haven't figured that out. There are many states that haven't yet expanded Medicaid, so that's a challenge. What happens when there's no public health emergency, there's no more federal supply? Well, the Biden administration actually, in recognition of this, put into their budget request to Congress the proposal to create a new federal mandated program for vaccines for uninsured adults, modeled after a pretty successful program that exists for children. That's not going to go anywhere. Congress is not going to do it, but I think it's a signal that this is a problem. This is going to be an issue because there's going to be a population of people who won't be able to get protection just because they don't have insurance. So that will be something to watch for, definitely.
I'm going to throw one more question at you. So we recently had bivalent vaccines come on the scene, and unfortunately, uptake of those has been not as great as we'd hoped that it would be. And we're heading into this season of substantial flu numbers already, and possibly more COVID cases. What does all this mean in the context of the public health emergency? You mentioned that, perhaps it will be extended through the winter. But if it's not, where does that leave us?
Well, on the vaccine front, if it's not extended, again, let's just play out that scenario. Let's say it ends in January. The upside of there being low vaccine uptake for the bivalent booster is we got a lot of bivalent boosters still, and those will be free. The supply is already there. And so it should be enough for most people to get their booster in the next few months. So I think that's the good side. Getting them to get their booster, that's always going to be a challenge. But from the supply side and also the cost side, the cost for consumers, I think we're mostly fine. I think it's beyond that where we have to really worry. If there's a new type of booster developed that's better and is needed, where's that money going to come from? Well, it's going to, insurers are going to be negotiating with the manufacturers, and it'll be commercial rates. And the commercial rates are going to be higher. To give you an example, for the bivalent booster, the federal government paid for Pfizer, as an example, about $30 a dose. For the first Pfizer doses, the initial ones that the federal government paid for is about $19 a dose, and the price started to go up. Well, Pfizer came out recently and said, we are thinking that the commercial price is going to be maybe $110, $130 a dose. So, there are going to be higher price per dose once it goes into the commercial market. And so that will, for people who have insurance, they shouldn't really see that, but it's for people uninsured who will, and also it's going to be a cost to the healthcare system.
Jennifer Cates, thank you so much for joining us.
Sure. Thanks for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.